Okay. The following are the non-therapeutic techniques. Why is non-therapeutic? Why is judgmental? Why is judgmental? Okay. Why are you virgin? Okay. That is judgmental. Next. Guys, you are not allowed to pick a statement that is negating. Negating, disapproving, rejecting is not therapeutic. Like, nurse, my temperature last night went up to 38.5. That's why I took antibiotic. What is the most appropriate response of a nurse? You cannot tell the patient like this. What you did is wrong. Mali yun. That's wrong. Is that clear? That is negating. Your statement should be statement of fact. Like this. Antibiotic is for infection, while paracetamol is effective for fever. That is supposed to be the accurate information and appropriate response. Do not analyze or interpret the feelings of the patient. You are not allowed to pick a statement that is not supported by the issue. Let's say, for instance, the situation is like this. The patient is seated on a chair while staring at the window. What is your most appropriate statement to the patient? Is this a correct statement? Good morning. Are you upset because your father did not visit you today? That becomes analyzing and interpreting because the situation did not mention that statement. Can you follow? Your statement should always be something that is supported by the situation. Next, let's continue. You are not allowed to give false reassurance. It's okay. Just pray and everything will be okay. That's false reassurance. Do not pass the buck. Look at me. There's an exemption to this. You cannot pass the buck. But if the inquiry or the question of the patient requires an expert to answer, like surgical procedures. Nurse, I will undergo Bill Route 2 surgery tomorrow. Can you pass the buck? Yes. I will call the doctor. Yeah, nurse, I will undergo Bill Route 2 surgery procedure. How is that procedure performed? What is your response? I will call the doctor and discuss this procedure to you. So we cannot pass the buck. But if that question requires an expert to answer that inquiry, you can pass the buck, like surgery. Technical procedures. We can pass the buck. There is an exemption. You are not allowed to change the topic, shift focus. Oops! Even if your advice is correct, it's not therapeutic because it becomes your opinion. It should always be a statement of fact. And do not argue, belittle, or judgmental to your patient. Nurse! There are so many ants crawling to the wall. I don't see any ants crawling to the wall. That is part of your illness. That is judgmental. Are you listening? Next, before I finally give you the drills, another policy. That's not therapeutic. Don't worry. That's reassuring. Okay? Concentrate. Giving approval. That's good. I'm glad you comb your hair today. I'm glad to see that you comb your hair today. I'm glad to see that you comb your hair today. I'm glad. It's not therapeutic. The correct statement should be, I notice you comb your hair today. Is that clear? Because when you say, I'm glad, that's too personal. That's approval. Is that clear? Sige. Next, reminder. Rejecting is negating. That's rejecting. Next, you cannot agree. That is your opinion. Okay. Nurse, my temperature last night went up to 38.5. That's why I took paracetamol. What you did is good. Yeah, that's correct. That's nice. Good job, good job. Wow. The statement should be matter of fact like this. Paracetamol is effective for fever. That is a statement of fact. Can you follow? Let's continue. Next. You cannot disagree. That is also rejecting or negating. Okay? Say, rejecting, negating, contradicting, disapproving, proving. You ask questions like you feel like you are the policeman. Okay? Now, tell me about what happened. Tell me your experience. Okay? It's not therapeutic. And you are not allowed to give advice because that is a negative. Okay? I will now give you the drills. I will give you grade 1 question to the grade 12 question. Try your best to apply the concept. But I'd like to remind you, what is the technique again? Whatever is that subject, if the question is response, statement, or say, from the 4 choices, you pick the choice that is what? Therapeutic. What is a choice that is therapeutic? It focuses on feelings. What is a choice that focuses on feelings? Something that explores the concern of the patient. Something that addresses the fears, the anxiety, and make sure, if there is a choice that is feelings, ask yourself, is this related to the issue? If so, then that is the correct answer. Are you ready? Let's now start with drill number 1. Apply the concept of therapy. Try your best. I will give you 30 seconds to analyze the question. Ready? Are you ready? Everybody must participate. Who answered Alpha? Bravo. Charlie. Delta. Let's discuss for perfection. Why did you not choose A? Why? Aside from the word why, what makes letter A wrong? Why don't you get married? At least there is someone who will support your baby. That is a statement about giving an advice. Is giving advice wrong?
Yes.
Yes, that is wrong. Even if you have your point, that's your opinion. So advising is wrong in the nursing exam. Next, you are a faithful person. Just, how did you know that she is a faithful person? It is not supported by the situation. Next, just pray. That's false reassurance. Next, you are a strong woman. How did you know that the patient is a strong woman? It is not supported by the situation. I know. Wow, you're a fortune teller. So what's our answer? C. I don't want this pregnancy. Your response, are you saying that you don't like this pregnancy? Is that related to the issue?
Yes.
Very good. Wait, are you saying that you don't like this pregnancy? You explore something that explores. Very good. What subject is this? Okay. Let's now proceed to the next level of question in the nursing exam. Level 2. Are you ready? Let's see. Who answered? What's the issue here? What's the issue? The phrase, I'm afraid that my child might have another seizure. What is the most appropriate response? What therapeutic response? What subject is this? Seizure is MS. Child. So this is Pedia MS. You see? But the question is what? Response. It requires magic. Let's see. Who answered Alpha? Bravo. Charlie. Delta. Alpha. Y. B. Will never. This is what? False reassurance. You are not certain if C or D is correct. If letter D is correct or C is correct. D or C. The question is what? Response. So where is the therapeutic there? C. Tylenol is for what? Fever. So when this is wrong. So what's our answer? C. Tell me. That is what? Exploring. Tell me what frightens. What frightens? When you say, tell me what frightens. Do you focus on the feelings of the patient? Yes. Tell me what frightens. It's not feelings. Yes. It's very powerful. You just have to follow the rules. Whatever is that subject, you can get the correct answer. Can you follow? Yes. Very good. Excellent. Let's proceed with the level 3. You see, this is special and MS. But you can have the ability to get the correct answer. Even if you are not well versed with the concept. Let's proceed. Let's see. Try your best. It's okay. Level 3 question. Try your best. You need to first pick the choices or remove the choices which you think are wrong. Is that clear? I think there are 2 possible correct choices there. And from the 2 correct choices, you need to use the test taking again. Where is the choice that is most relevant to the issue of the question? Most relevant. Are you ready? Are you ready now? Let's go. Let's go sa go. Okay, let's proceed. Who answered Alpha? Bravo. Charlie. Delta. Charlie. Press C. What would you like to talk about today? Nothing. Wait for Delta. Nothing. You approach the patient and just stay there. Nothing. You wait for the patient to talk. So this is wrong. Okay? Now, let's analyze the question. The client just began to discuss important feelings when the time of interview is up. The next day, the nurse meets with the client at the agreed upon time. So let's say, for instance, the next day, you agreed with the client to meet on this place at this certain time. Which of the following is your initial? To say. So, let's say for instance, a situation is like this. So the patient is there waiting for you. Which of the following is first? Is it A or B? So you saw the patient waiting there. So you approach the patient. While you approach the patient, which of the following would you say first? Which of the following would you say first? Yesterday you were talking about, or which of the following would you say initially? Good morning. So which of the following is the initial? Is it A or B? A. That is common sense. That's the issue. Walang concept yan. Are you see? You agreed with the patient to meet the next day at this time. So, which of the following is the initial statement, initial say? So which of the following is the first statement, A or B? A. Are you listening? It is very inappropriate to say letter B. You saw the patient seated there. Yesterday you were talking about, unless you're schizophrenia. So what's the correct answer? Letter A. Let's continue. What subject is that?